Have you ever wondered? Hey everyone, welcome back to Inquisitive Creation. My name is Gilo, and I will be your trusted companion to explain things you ever wondered about but does not exactly know what they are. In today's video, we'll uncover the surprising ways grapefruit can impact your health. Now, you might love the tangy taste of grapefruit or enjoy a refreshing glass of its juice. But did you know it can be dangerous for some people, especially when it comes to certain medications? From unexpected interactions to potential side effects, you won't want to miss this eye-opening information. So grab a notepad and let's get started, because knowing the facts about grapefruit could save you a trip to the doctor's office. But before I start, don't forget to give this video a thumbs up and subscribe to my channel for more essential health tips. It is unusual that a fruit with significant health benefits could also be dangerous for some people to eat. But that's the case with grapefruit, says Dr. David Bailey, a clinical pharmacologist and scientist at Lawson Health Research Institute in London, Ontario. Dr. Bailey is the researcher who discovered over 30 years ago that grapefruit interacts with many common medications taken by mouth, including several oral cancer drugs. If you take one of the affected drugs, you've probably noticed a warning on the bottle's label or in the patient information guide from the pharmacy. Grapefruit contains compounds called furanocoumarins that inactivate the CYP3A4 enzyme in your intestine. This enzyme is very important in the metabolism of certain oral drugs, so blocking its action means more of the drug enters your blood. Even small amounts of furanocoumarins can cause dangerous levels of some drugs to build up in your blood. A 1998 research review Dr. Bailey and his team published in the British Journal of Clinical Pharmacology reported that just 250 milliliters, about 8 ounces of grapefruit juice, multiplied drug levels in the blood up to 3 times compared with water. Drinking the juice 3 times a day for 5 days further increased drug levels by as much as 5 times. Combining grapefruit with certain drugs can potentially cause toxic side effects. In the worst-case scenario, grapefruit can be deadly when combined with some medications. Grapefruit isn't alone in containing furanocoumarins. Limeys, pomelos, and bitter Seville oranges, oftentimes used in orange marmalade, also have them. Of these, grapefruit has been studied the most because it's commonly consumed in large enough quantities to cause a reaction. And it's not just the juice, but also the fruit and rind that can be problematic. Sweet Valencia or navel oranges do not contain furanocoumarins and therefore are safe substitutes. However, furanocoumarins can affect everyone differently. Some people make more of the CYP3A4 enzyme than others. Those with more CYP3A4 in their small intestine are at greater risk of drug toxicity if they consume grapefruit. But without testing, it's impossible to predict who will be affected by grapefruit. Because the degree of interaction is so variable, doctors and pharmacists recommend that anyone taking an affected drug avoid grapefruit and related fruits. In 1989, when Dr. Bailey and his team discovered the grapefruit interaction, 85 drugs were on the interaction list. Today, that list is up to 121 medications and possibly could be even more. They range from heart and blood pressure drugs to anti-anxiety medicines to a growing list of anti-cancer drugs. The interaction is drug-specific, so not all medications within a class are affected. Some common drugs that interact with furanocoumarins include certain oral anti-cancer drugs called tyrosine kinase inhibitors. Some of these include abemaciclib, crizotinib, dasatinib, erlotinib, everolimus, palbociclib, pazopanib, ribociclib, and sunitinib. Blood pressure and heart medications such as felodipine, nifedipine, and dronedarone. Certain cholesterol medications like atorvastatin, simvastatin, and lovastatin. Some anti-anxiety medications including diazepam and buspirone. Oral central nervous system agents and pain medications such as oxycodone, fentanyl, and ketamine. Some people taking Viagra have had very serious and uncomfortable side effects because of the increased potency of the drug when combined with grapefruit. It can also result in flushing, headaches, low blood pressure, and fainting. According to Dr. Bailey, 60% of the drugs that interact with grapefruit juice are high risk with potentially severe adverse reactions. And of those high-risk drugs, 27 are kinase inhibitors, oral medications used in cancer treatment. Kinase inhibitors are a type of medication that target specific enzymes called kinases. Kinases play a key role in many cellular processes, including cell division, growth, and signaling pathways. They help transfer phosphate groups to other molecules, a process known as phosphorylation, which can activate or deactivate proteins and other molecules. In simple terms, kinase inhibitors work by blocking the activity of kinases, which can help control or slow down the growth of cells. This can be particularly useful in treating diseases like cancer, where certain kinases may be overactive and promote the growth and spread of cancer cells. Kinase inhibitors are used in various medical treatments, especially for different types of cancer, as they can target specific kinases involved in cancer cell proliferation. By inhibiting these kinases, the drugs aim to reduce tumor growth and progression. Now, as cancer treatments evolve, significantly more oral anti-cancer drugs are being used. The number of oral cancer drugs that interact with grapefruit has increased tremendously over the past decade. These drugs treat a wide range of cancers, so more and more patients are at risk. It is also interesting to note that the grapefruit effect is long-lasting. It can take up to 60 hours for the CYP3A4 enzyme to become fully effective again after drinking grapefruit juice. Because of this, it's not unheard of for a patient to accidentally eat a grapefruit and report drug toxicity symptoms a day or two later. In 2012, Dr. Ezra Cohen, an oncologist at the University of California, San Diego, led a clinical study to see if cancer patients could use the grapefruit effect to their advantage. He examined whether grapefruit juice could be used to intentionally boost the potency of a cancer drug, thus decreasing the amount needed for treatment, and it worked. The study, published in the American Association for Cancer Research journal Clinical Cancer Research, showed that drinking 8 ounces of grapefruit juice daily boosted levels of the drug rapamune by 350%. While the results were exciting, Dr. Cohen notes that getting a consistent effect from grapefruit is challenging. Besides the variability in CYP3A4 enzyme among people, furanocoumarin content also varies. With grapefruit varieties and juice processing methods, he explains. Still, he says, it's something to consider on a case-by-case basis. If there is a need to reduce a medication dose to minimize side effects or control cost. But grapefruit should only be used under strict medical supervision where drug levels can be monitored because of the risk of toxicity. Dr. Cohen further stresses that the grapefruit interaction warning appears on certain cancer and other medication labels for an important reason. Unless your doctor advises otherwise, steer clear of grapefruit while on these drugs. If you are unsure whether your medicines interact with grapefruit, ask your oncologist or pharmacist. In conclusion, grapefruit can be toxic when consumed with certain medications, because it contains compounds that interfere with the body's ability to metabolize drugs. This can lead to an accumulation of the medication in the body, potentially causing harmful side effects or increasing the risk of overdose. It is particularly important to be cautious with grapefruit. If taking medications like statins, some anti-anxiety drugs, or certain heart medications, always consult a healthcare professional before consuming grapefruit with medications. Thanks so much for watching today's video on the dangers of grapefruit. We hope you found this information helpful and that it encourages you to be mindful of your grapefruit intake, especially if you're taking certain medications. If you enjoyed this video, don't forget to give it a thumbs up and subscribe to my channel for more eye-opening health content. And if you think someone else could benefit from this info, go ahead and share the video with them. Also, hit that notification bell so you never miss out on our latest updates. Until next time, stay healthy and take care. This is your friend Gilo signing off from Inquisitive Creation. Thank you so much for watching.